Okay, so you want to take a deep dive into early cancer detection?
Smart move.
Not always uh, the easiest topic, you know,
Yeah,
but knowledge is power, right? And that's what we're going for here. We
absolutely.
got some really solid sources lined up this time. UCSF, Johns Hopkins, even an article by a breast surgeon who went through breast cancer herself.
Oh, wow. First-hand experience. That's powerful.
It really is. We've also got some info on like an app designed to help people navigate cancer care.
Okay, so it's about taking action too.
Exactly.
So
We're not just here to tell you to worry. We're going to give you actual tools and insights.
love it. Because, a cancer diagnosis can feel overwhelming for anyone.
Absolutely.
But the good news is survival rates are improving, and early detection is a huge part of that.
Huge. So that's our mission, really.
Empowering, not overwhelming, right?
Right. Exactly.
hmm
We're going beyond the obvious warning signs and getting into those sneaky symptoms, the ones you might not even think twice about.
Like, should I get that checked out?
Yes. Because
feel
it's all about knowing your body, feeling comfortable, advocating for your health.
I'm all about that.
Okay, so the UCSF article, right off the bat, they list 17 potential signs of cancer. 17.
Wow, 17.
Some are, the classics, but then there are these others, like you wouldn't automatically think cancer.
Right, right. Because a lot of symptoms could be nothing serious, but if it's persistent, if it's unexplained, that's when it's time to pay attention.
Exactly.
Bloating, everyone gets bloated. But if it sticks around for more than 2 weeks and you haven't, changed your diet or anything, the UCSF article specifically mentioned that could be a sign of ovarian cancer.
See those sneaky ones.
Yeah, the ones that make you go, huh?
Okay, and it's not always just like physical changes either. The Johns Hopkins article really honed in on fatigue.
Okay, sure. And I mean, who isn't tired these days, right?
Right, exactly. But they're talking about a different kind of tired.
Okay, so not just your regular need another coffee fatigue.
No, this is different.
So basically, cancer cells, they're like little energy vampires. They steal the nutrients your body needs, to function.
Really?
Yeah, so that fatigue that comes with cancer, it's often described as like deep, bone-deep exhaustion.
Oh, wow.
And it can be one of the earliest signs, even before a tumor is detectable.
So it's really paying attention to those subtle shifts.
Yes, your body is always sending signals.
Speaking of paying attention, what about moles? We all know to watch for changes in size or color, but the UCSF article gets pretty specific with their ABCDE rule.
Oh, yeah, that's a good one. The ABCDE rule, it's super helpful for remembering what to actually look for.
Break it down for us.
Okay, so A is for asymmetry. So one half of the mole doesn't match the other.
Okay.
B, border irregularity, like are the edges jagged or blurry? You want those nice smooth borders.
Got it.
C, color, is it changing? Is it uneven?
And then D.
D is for diameter. Anything bigger than a pencil eraser, you want to get that checked out.
Okay, so that's like a more concrete way to gauge it.
Exactly. And finally, E, evolving. Basically, is anything changing at all? Size, shape, color, elevation, or even new symptoms like bleeding, itching, crusting, any of that.
That's so helpful because otherwise it's like, well, I don't know, it looks different.
Exactly. This gives you something concrete.
It's empowering.
Totally. You're not just guessing anymore.
Right, you know what to look for.
Exactly.
Okay, you know what else I found really eye-opening while we were prepping for this deep dive?
What's that?
That article by the breast surgeon who was diagnosed with breast cancer.
Oh, wow, yeah.
Talk about a wake-up call, right?
Seriously, and you'd think, of all people, a surgeon would know, but
You'd think.
she talks about how even with all her training, all her knowledge, nothing could prepare her for the emotional impact of hearing those words, "You have cancer."
Wow.
It's like she knew the science, but she didn't really know until she was the patient.
That really makes you think about the whole human side of this.
For sure, it's not just the diagnosis, it's not just the treatment, it's everything else that comes with it.
Exactly.
It's wild, right? Like she talks about how in that moment, all those phrases, the ones she used to use with her own patients, they felt so empty.
Wow.
Yeah, like she finally understood on a whole other level,
Yeah, the weight of it all.
Exactly.
It's like there's knowing the words and then there's knowing the reality.
And sometimes you don't get that reality until it's you.
Right, and she talks about that feeling of information overload too.
Oh, yeah, totally.
Like being bombarded with leaflets and statistics,
Yeah.
but not having the tools to actually process it all.
Absolutely, because it's one thing to understand the science, but then there's the whole human element of actually going through it.
Right, like how do I actually live with this?
Yeah.
It reminds me of that saying, you don't really know someone until you've walked a mile in their shoes.
So true.
And in her case, it was literally walking a mile in the shoes of her patients.
Wow. Yeah.
You know, one thing that really struck me was how she talked about feeling like a terrible patient.
Really?
Because she was struggling to manage her own care, even as a doctor.
It just goes to show, a cancer diagnosis, it can throw anyone for a loop.
Totally.
Yeah.
Doesn't matter who you are or what you know.
Absolutely. And she talks about how she was prescribed this medication. It was to shut down her ovaries as part of her treatment.
Okay.
And she had no idea what to expect, the side effects, the emotional impact, anything.
Wow. So what did she do?
She turned to Google, just like so many of us probably would.
Nope.
Yeah, looking for blogs, forums, women who had been through the same thing.
So this highly trained surgeon is finding solace in online patient communities.
It's incredible, right?
It really speaks to the power of shared experience.
Totally, because those communities, they offer this validation, this sense of you're not alone that you might not find in a doctor's office.
Right. It's like a safe space to vent, to ask questions, to share tips.
Exactly. And, she actually suggests creating a centralized resource.
Oh, interesting.
Where patients can share all of that, tips on managing side effects, coping mechanisms, anything that helped them through it.
That's a fantastic idea.
Right. Like a database of real-world advice from people who've been there.
It could make such a difference.
For sure. And, she doesn't shy away from the tough stuff either.
Like what?
Well, the way she talks about chemotherapy, it's raw. It's honest.
Yeah.
And she describes it as this, shock to her body, almost like a betrayal.
Wow.
She lost her sense of taste and smell, which, can you imagine?
That would be so disorienting.
Right. And then there's the self-consciousness, the questioning, the fear of recurrence, that anxiety, she called it.
It's anxiety, yeah.
It stays with you even after treatment.
It's that reminder that the impact of cancer, it goes so far beyond the physical.
Absolutely. It affects every single part of your life.
And you know what else she talks about?
What's that?
The importance of understanding the signs of recurrence.
Yeah, because it's one thing to go through treatment, but then you're left with this fear,
Right, is it back?
Exactly. And if you don't know what to look for, every ache and pain can feel like a threat.
So true. It's like you said, knowledge is power.
Always. And she actually had to educate herself on this stuff.
Really?
Yeah, she was taking tamoxifen, which is supposed to prevent breast cancer recurrence.
Okay.
But she hadn't even learned about its side effects in medical school.
Oh.
Crazy, right?
It really highlights the importance of ongoing education.
100%. For patients and for doctors.
Because things are always changing, always evolving.
Always. And we all need to keep up.
Absolutely. And she's a big advocate for doctors really understanding the treatments they prescribe.
Not just writing a prescription, but actually getting it.
Exactly. Knowing the potential side effects, how it might impact their patients' lives, the whole picture.
It's about recognizing that everyone's different. There's no one-size-fits-all approach to cancer care.
So true. And she talks about how she actually had to seek out help for the menopausal side effects of her treatment.
Oh, wow.
And her GPs didn't know how to help her.
Seriously. That's unbelievable.
Can you imagine?
It just goes to show there's still so much we don't know, even about such a common experience.
And she's really pushing for better support systems for women going through menopause.
Which is huge.
Absolutely. Whether it's from cancer treatment or just a natural part of aging.
We need to normalize those conversations.
Yes. And make sure women have the resources and support they need.
100%.
As we're talking about all this, I keep thinking about how she chose her surgeon.
Oh, yeah.
She was actually given a choice about where she wanted to be treated.
Wow, that's a big decision.
Right. And she talks about how daunting it was.
Because who do you choose? The surgeon with the best bedside manner or the one with the most experience? Tough call.
And in her case, she decided to stick with her own surgeon.
Interesting. So there was already a relationship there.
Exactly. And I think there's something to be said for that existing trust.
For sure, but it's also important to acknowledge the complexities of that kind of relationship,
Totally, because it's not just doctor-patient anymore. It's also friends.
Exactly, and that can blur boundaries.
Right. And she talks about how she felt this responsibility to protect her surgeon.
Protect her how?
Like to shield her from the emotional burden of treating her friend.
Oh, that's heavy.
It is, and it shows how those roles can shift in such complex ways.
Because we often think of doctors as these, objective figures, but they're human too.
Absolutely. And she doesn't shy away from the tough conversations either.
What do you mean?
Well, she talks about how she had to advocate for herself, push for certain treatments or tests, even if it meant potentially jeopardizing the friendship.
Wow, that takes courage.
It does, but it's so important to remember that you have a voice.
Always. And you have the right to advocate for your own health.
Exactly. It's about finding that balance between trust and assertiveness.
And that's not always easy.
Definitely not, but it's a conversation worth having.
For sure. And, one thing that really stuck with me was her emphasis on open communication.
Oh, yeah. With who?
With everyone, your doctors, your loved ones, everyone.
Because cancer can be so isolating.
Absolutely. But it doesn't have to be.
Right. And she talks about how she had to learn to ask for help, to lean on her family and friends.
Vulnerability is tough, but it's so important.
It is, and she found that by letting people in, she discovered a whole new level of love and support.
It's true. It sounds like she really had to embrace that vulnerability to heal, and not just physically, but on every level.
Absolutely. And it makes you think about those people in your own life, the ones you can really be open with.
The ones who can handle it.
Exactly. And she talks about this idea of the collateral damage of cancer, those hidden scars.
Oh, yeah, the stuff people don't see.
Because everyone sees the survivor, the one who beat cancer, but they don't see the anxiety, the fear.
The impact on relationships, the financial strain. It's a lot.
And you feel like you have to put on a brave face,
Mm-hmm. Totally. Everything's fine, but inside, you're struggling.
It's so easy to do that.
And that's why it's so important to talk about it, to let people know it's okay to not be okay.
To ask for help when you need it.
Exactly, because the journey doesn't end when the treatment does.
She mentioned something else that really resonated with me. She had misconceptions about certain procedures, even as a surgeon.
No way, really?
Yeah, she talks about her experience with radiotherapy.
Okay.
Her old bosses used to describe it as just like an X-ray treatment.
Wow. It just goes to show even doctors can have blind spots, especially about things they haven't personally experienced.
Exactly, and it makes you think, how many patients are out there suffering in silence?
Because they don't want to walk the boat, or maybe they don't even realize it's not supposed to be that way.
It's like she says, we need more empathy in healthcare, more willingness to really listen to patients' experiences.
100%. To validate their concerns, even if they don't fit the textbook definition.
She actually suggests that doctors should have to undergo some of the procedures they recommend.
Wow, that's a thought.
Right. But it makes you think, how can you really understand what someone's going through if you haven't walked in their shoes?
It's like that saying, but on a whole other level.
Right. And it goes back to that idea of lived experience.
Because reading about something and experiencing it firsthand are two totally different things.
Absolutely. And, as we wrap up this deep dive, I keep coming back to her 3 suggestions for improving cancer care.
Okay. Yeah, what were they again?
First, giving patients a curated list of reliable resources like websites, forums, apps, things like that.
Okay, so going beyond the pamphlets.
Exactly.
Yeah.
Because people want information, they want to connect with others, they want to feel empowered.
Totally. And her second suggestion?
Clear and consistent communication about recurrence.
So patients know what to look out for, what's normal, what's not.
Exactly. It's about giving them the knowledge to advocate for themselves.
So important. And the third one?
Having those difficult conversations.
About what kind of thing?
Work, sex, exercise, the fear of recurrence, everything.
Wow. Okay, so really getting real about it.
Because it's all part of it, right?
Yeah.
It's about treating the whole person, not just the disease.
100%. Because cancer affects every aspect of your life.
It really does. And healing, it's not just about the physical stuff, it's about everything else too.
Mind, body, spirit, the whole package.
Exactly. So, as we wrap up, I want to ask you, what are you taking away from this deep dive?
Well, for me, it's about stepping into that space of empowerment, Knowing that knowledge is power, trusting your gut, asking questions, advocating for your needs.
It's about taking control of your health journey.
Exactly. And remembering that you're not alone in this.
There are resources out there, communities ready to welcome you, and a whole lot of knowledge to tap into.
This deep dive is just the beginning.
Absolutely. And we're here to support you every step of the way.